Amiloride-Hydrochlorothiazide is a medication used to treat high blood pressure, heart failure, and extra fluid in the body. It contains two medications, amiloride and hydrochlorothiazide, both of which are water pills that help your body get rid of extra salt and water. This may increase the amount of urine you make when you first start taking the medication. Amiloride also helps to treat or prevent low blood potassium levels. It is important to take this medication as directed by your doctor and to follow the recommended dosage. It is best to take this medication at the same time each day, and it can be taken with or without food. Be sure to talk to your doctor about any concerns or questions you may have about taking amiloride-hydrochlorothiazide. When taking amiloride-hydrochlorothiazide, it's important to take it with food as directed by your doctor, usually once or twice a day. If you take this medication too close to bedtime, you may need to wake up to urinate, so it's best to take it at least 4 hours before bedtime. The dosage will be based on your medical condition and response to treatment. It's important to take this medication regularly at the same time each day to get the most benefit from it, even if you feel well. If you also take certain drugs to lower your cholesterol, make sure to take this medication at least 4 hours before or 4 to 6 hours after those medications. And if your condition does not improve or worsens, be sure to tell your doctor. Some common side effects of amiloride-hydrochlorothiazide may include headache, dizziness, nausea, vomiting, loss of appetite, stomach/abdominal pain, gas, or diarrhea. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. While many people using this medication do not experience serious side effects, it's important to be aware of the possibility of dehydration and electrolyte imbalance. Contact your doctor immediately if you experience symptoms such as extreme thirst, muscle cramps, weakness, fast heartbeat, severe dizziness, confusion, fainting, or seizures. Additionally, it's crucial to notify your doctor if you experience any serious side effects, including persistent nausea/vomiting, yellowing of the eyes/skin, dark urine, joint pain, signs of kidney problems, decrease in vision, or eye pain. While a severe allergic reaction to this drug is rare, seek medical attention if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Please note that the contact information provided for reporting side effects is for residents of the US and Canada. Rarely, this medication can cause high levels of potassium in the body, especially in older adults and those with kidney disease, diabetes, or a serious illness. It is important to regularly monitor potassium levels while using this medication to avoid any potential complications. If left untreated, very high potassium levels can be life-threatening. If you experience symptoms such as muscle weakness, slow or irregular heartbeat, or numb/tingling skin, be sure to inform your doctor immediately. Before taking amiloride-hydrochlorothiazide, it's important to talk to your doctor if you are allergic to amiloride or hydrochlorothiazide, or if you have any other allergies. This medication may also contain inactive ingredients that could cause allergic reactions or other problems. Make sure to inform your doctor about your medical history, especially if you have electrolyte imbalance, kidney or liver disease, diabetes, dehydration, lupus, gout, high levels of fats in the blood, or skin cancer. Also, let your doctor know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products before having surgery. Be cautious as this medication may make you feel dizzy and can be worsened by alcohol or marijuana. Avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. It is also important to stay hydrated to prevent dehydration, especially if you are on restricted fluid intake. Consult your doctor for further instructions. Amiloride-hydrochlorothiazide may make you more sensitive to the sun and increase your risk for skin cancer, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you have diabetes, make sure to check your blood sugar regularly and inform your doctor if you have symptoms of high blood sugar. This medication may also affect the potassium levels in your blood, so consult your doctor before using potassium supplements or salt substitutes that contain potassium. If you are pregnant or breastfeeding, discuss the risks and benefits with your doctor before using this medication. It's important to be aware of potential drug interactions that may change how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. It's important to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with amiloride-hydrochlorothiazide include dofetilide, lithium, sodium phosphate products, other products that may affect potassium levels, birth control pills containing drospirenone, other diuretics, ACE inhibitors, and angiotensin receptor antagonists. Additionally, some products have ingredients that could raise your blood pressure or worsen your heart failure. It's important to tell your pharmacist what products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. It's also important to note that this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. Always consult with your healthcare provider for the best time to take this medication and the appropriate daily dosage. If someone has taken too much amiloride-hydrochlorothiazide and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe dizziness, fainting, and a slow or irregular heartbeat. It's important not to share this medication with others. Lifestyle changes like stress reduction programs, exercise, and dietary changes can help increase the effectiveness of this medicine. Be sure to talk to your doctor or pharmacist about what lifestyle changes might benefit you. While taking this medication, it's important to have lab and/or medical tests done to check your kidney function, blood mineral levels such as potassium, and skin exams. Make sure to keep all medical and lab appointments, and consult your doctor for more details. It's also important to check your blood pressure regularly while taking this medication, especially when you first start this drug or when your dose is changed. You can learn how to monitor your own blood pressure at home and share the results with your doctor. If you forget to take a dose of amiloride-hydrochlorothiazide, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store amiloride-hydrochlorothiazide at room temperature away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, be sure to properly discard this product. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.